Hi, this is Dr. Meral El Ramahi reporting to you on day 1, June 2nd of UR 2021 from Cleveland, Ohio for Room Now. Day 1 had a lot of great information on spondyloarthritis. I'd like to highlight some of the takeaway points. Dr. Atul Deodar gave a fantastic presentation titled Non-Radiographic or Radiographic Axial Spondyloarthritis. Does it matter? As a recap, the prevalence of axSpA in the US is 1%, and the proportion of non-radiographic axSpA versus ankylosing spondylitis is 50-50. Dr. Deodar reminded us in this presentation that the current consensus is that ankylosing spondylitis and non-radiographic axial spondyloarthritis are the same disease and represent two ends of a spectrum. Why some people deposit bone and others don't is unclear. Most importantly, he emphasized that the disease burden is equal in both non-radiographic axSpA and radiographic axSpA. He then tackled the controversial topic of whether or not we should treat non-radiographic axSpA patients who do not have objective signs of inflammation. RCTs show that biologics have no efficacy in patients without objective signs of inflammation, such as radiographic sacroiliitis and elevated CRP. However, there are important points to consider before deciding not to treat non-radiographic axSpA. Firstly, Dr. Deodar reminded us that MRI assessment was limited to the sacroiliac joints, but there could be inflammation of the spine or posterior elements that were not accounted for in the RCTs. Secondly, CRP is not a very sensitive marker of inflammation in axSpA. Only 30 to 40% of patients may have an elevated CRP. Thirdly, biologics may have an effect on nociception, not just inflammation. Dr. Deodar raised the point that maybe we should not apply group-level results from RCTs to the individual, especially if we're convinced of the diagnosis of non-radiographic axSpA and if the patient is suffering. He puts forth the concept of which we should consider giving a medication trial in such situations. He next spoke about a post-hoc analysis currently submitted for publication of COAST-V, for TNF-naive patients, and COAST-W, TNF-experienced patients, which showed that execuzumab still worked in improving ASAS-40 response, even in the absence of elevated CRP and MRI scores. It was a wonderful opening day of UR 2021. Please tune into Room Now for further coverage of UR.